Good morning. Welcome to another program of ShuraTV on health matters. My name is Dr. Zachariah. Hopefully, you have had a great week and you're doing well. I'm glad that you've tuned into our program. We want to continue today and discuss a little bit more about cardiovascular disease or heart disease and some different topics in and around heart disease and what we can do in terms of assessing ourselves and getting ourselves assessed by our doctors and making sure that our heart health is good. February is Heart Health Month, and we are in a new year, 2022, and it is a good time to take an assessment and make sure that everything is in tip-top shape. Before we do that, a little bit update about the Corona Omicron virus. Thank God, the numbers are going down, and we encourage you and your loved ones and your children to get the vaccine, get the booster, and we're slowly getting ahead of the virus, and the numbers, hospitalizations are dropping, the case rates are dropping here in Southern California, which is great, and we continue to promote social distancing and masking, and especially places that are crowded and you don't know the people. That's great. And then also California has now come out with a plan that by February 15th, they're going to lift all their mask mandates. So by February 15th, which is coming up next week, I think California has decided, and it's the health authority, that the mask mandates will be lifted, and but still you have to be careful, and if you have children that are unvaccinated, you have to protect them. That's very important. But encourage people to get the vaccinations, and the numbers are dropping, the hospitalizations are dropping, and especially here in Orange County, and hopefully in your neck of the woods as well. So that's some good news that we wanted to share with you on that end. But continue to be vigilant and smart about your actions and where you go and what you do. That's very important. Mitigate your risks and then live your life. Yeah, that's something that's important for us all to do. Last week we discussed some different issues on heart disease. And heart disease, we mentioned that lack of physical exercise here in the U.S., lack of good foods, nutritional foods, and the sedentary lifestyle. These things all contribute to different risk factors for heart disease. Specifically, another major risk factor that we didn't get into too much was smoking and the use of tobacco, which is directly correlated with lung and heart disease. So people that are smoking, that do smoke, and now even with the vaping has a lot of different chemicals in it. It has over 300 different chemicals in it that are detrimental to the arteries and to the vascular system. So it's important to keep those things in mind. And of course, things that we can't change are, our family history, our age, our gender, race, ethnicity, things like this that are inherent, that cause us different risk factors that are there for heart disease. Things that we can change, as I mentioned, the physical activity, the diet, obesity, which is a huge epidemic here in the U.S., our stress levels, mindfulness, having an awareness of where we are, what we're doing, breathing, taking time out of our daily routine so that we give a little bit time to our body so that we can really breathe and assess what's going on. That's very good for our health and for heart health. And then, of course, tobacco and alcohol. If anyone is consuming alcohol and smoking, I would advise you to decrease that and get out of that rut. Don't continue with that, because those are big factors for heart disease. We discussed a few different categories of heart disease last week. We had the vascular diseases, which was the coronary artery disease, which was the arteries around the heart that they get clogged up. And then we have peripheral arterial disease, which is with things like diabetes and things that are systemic, you get tingles and you get end organ issues in your kidneys, in your fingertips, in your legs, in your feet. You get in your eyes, you get different pathologies that we discussed. That's peripheral arterial disease, and then of course the cerebrovascular diseases, or which are people that get strokes and microstrokes and infarcts and little blood clots that are traveling in the brain. And ultimately, it's a stroke, which we don't want people to get. That's the other uh, sequelae or a result of heart disease that can happen with people who have arterial blockages, or they have clots that are forming. And then, of course, I mentioned the kidney. There's a renal arterial stenosis, which is the narrowing of the vessels that get to the kidneys. That's something which causes kidney disease. And then you have aortic aneurysms. Aortic aneurysms is where the main pipe that's going in away from your heart, the aorta, it gets bubbling, and the lining of that gets a pathology where it gets the same thing as you would when you get a clot in your coronary artery disease, and that causes major problems. And if you don't catch that early, that's a sudden death. So we want to keep ourselves from getting all these types of issues with the vascular diseases. Uh, the specific heart disease that we discussed were the cardiomyopathies, which is the muscle itself, the inflammation of the muscle. And then, of course, we have the hypertensive heart disease, where people who have high blood pressure, because of the stress on the heart pumping, the heart gets bigger and bigger, and the muscle gets weaker. So you have more blood left in the legs, and the pumping mechanism of the blood of the vascular system decreases. So that increases your risk of clots and embolisms and strokes and heart attacks. And then, of course, the end result of that, all that is heart failure, where the muscle itself fails to succinctly, uh, uh, you know, contract and push that blood out to the organs. Also, you have pulmonary heart disease. Pulmonary heart disease is when the vessels of the heart, uh, they're giving you, sending arterial blood to the lungs, and you have a stenosis or a blockage, or you have lung issues where it prevents the lungs from getting the fresh oxygenated blood. This leads to a lot of shortness of breath, a lot of pulmonary complications, and then we have the electrical issues of the heart, which are the cardiac dysrhythmias, hyper tachycardia or bradycardia. People have hearts that are overactive or non are very slow. They're not beating in sequence. The sequence is messed up. The muscles aren't beating in together. The four chambers aren't coordinated. So these things all come about from the dysrhythmias and the electrical system of the heart. And then, of course, you have endocarditis, and which is the root of it is inflammation, which is you get that the endometrium of the heart, you get that inflammation. And a lot of people say that's also connected to your dental hygiene, which is important. Dental hygiene has a direct effect on your heart, because a lot of the materials and the toxins that are left in the mouth, that are under the gums and get into the bloodstream, end up going into the cardiovascular system. So that's why dental hygiene is very important. I encourage you to use mouthwash daily and really get rid of those bacteria that build up in the mouth. That's very important. Of course, I'm hoping you're brushing and flossing regularly. That's a given. But I would add utilizing a mouthwash, so that these bacteria are not seeping into your blood system. It's very important to keep in mind. Um, Myocarditis, we discussed, the muscle of the heart itself getting inflamed. And then we have the valve diseases of the heart, right? The valve diseases, you have between the chambers, there's valves. Sometimes those valves leak, and those valves need to be replaced by surgery, or they have to go in and ablate them, or alter them so that they function. So these are issues that are coming up, and the ones that people are born with are the congenital heart diseases, where you have infants that are born and they get surgery right away, or they have misaligned heart. These things can happen and do happen, and we get the surgeries for those. And then, of course, you have the rheumatic disease, which are viral issues which affect the heart. These things all play an important role in heart health. So these were the things that we kind of classified. Now, moving to, what do we do to keep good heart health? What's the best thing to do? And researching this and looking at it from different aspects of medicine. Uh, Number one, of course, there's the medications that are out there, the pharmacology. Uh, we're in the 21st century. There are many different medications that your cardiologist or your family doctor will give you for things that can prevent heart disease. Your antihypertensives, your and the statins, which are against the lipids. You have anything that helps these vascular system function will prevent heart disease. Anything that does that. So if you kind of group it that way, so if you're on blood pressure medications, if you've had blood pressure, or you're trying to, a lot of people I run into, they're trying to deal with it with lifestyle changes, and they've been doing it. If you can't change your lifestyle in a matter of 3 to 5 months, then you need to be on that medication. So the doctor gives you, your doctor will tell you, right? They'll say, hey, go, change your lifestyle, stay away from these kind of foods, do this, do more exercise. And if you can do all that, that's great. That's wonderful. But if you can't achieve that in 3 to 5 months, then you need to take your antihypertensive medication. You can't, be afraid of being on those medications, especially if you need it. There's no, award or being a hero for avoiding medications that your body needs that are available to help you live a more quality filled life. A lot of people are, I'm going to do it myself, and they have this false dependence on themselves that, yes, I can do it. I can get my, life in gear, and I'm going to have a better lifestyle. I'm going to eat well. I'm going to do this. They'll do it for a week or 10 days, but after that, they fall back into their normal pattern. So if that's you and you recognize that, the important thing that you have to recognize is that you need to be on your medications, especially during a pandemic. Here we are in the end of a COVID pandemic, and a lot of people haven't seen their doctors for anything necessary. I was reading an article. They said that in England, with the NHS, there's been 6 million visits that have been missed on regular maintenance of health because of COVID. So I'm sure in the US, the same thing has happened. So there's a lot of assessments. There's a lot of maintenance for your body that hasn't been done in the last 2 years. And I hope and I wish that you have been taking your regular medications regularly, and you need to discuss that with your doctor and make sure that you're taking care of your body. You're not letting things go. And then there's, of course, diagnostics that people do yearly or every 2 years or 3 years. You need to get all that done. And that's why we're discussing heart health, because heart health is one of the most important things you can do for your body, is make sure that you assess yourself and have your doctor take care of you, and do a EKG test and do a stress test if necessary, get imaging of your heart muscle, get everything in shape so that you know that you're doing well. That's very important. And if your doctor doesn't do it, then you can yourself be an advocate for yourself and find out where there's cardiologists that can do just an assessment for you, so that you know that your heart health is good. You don't want to wait, a few years where you have severe pain, and then they tell you, oh, your vessels are blocked 98% or 96%, or you've avoided this chest pain or this back pain that you've been having in the center of your back or in your shoulder, and it's chronic, and it's always right here, and you feel like an elephant stepping on your chest, and you feel this, but you just kind of work through it, and you're like, okay, we'll see what happens. No, you need to go get that assessed. It's important. It's very important. You have everything at your disposal here. You're living in a country where everything is available for you. Go take advantage of it and take care of your health. and don't really buy into these conspiracy theories or these these stories that, oh, I don't want to go in and they're gonna, you know it's going to cause me more problems, or it's going to be a big long roadmap that I have to follow to get to health. No, I mean, these doctors are there for you. These systems are there for you so that you take care of yourself. And it's our responsibility, and our body is a trust to us from God. So we should take care of it. So it's important, especially heart health. Heart health, again. So, number one thing that we have seen in terms of heart health is exercise, physical exercise. If you can do three hours a week, 3 hours a week, so you can divide that, into 4 days, into 5 days, into 6 days, half hour, whatever. You just do something that increases your heartbeat and gets the blood flowing, and not only does that help your heart, it helps everything else as well. Your insulin resistance, your metabolic syndromes. It increases your metabolism. It does wonders for you. So if you can do that, that's wonderful. Number one, exercise, physical exercise. Number two is being conscious of what your intake is, taking foods that are not high in saturated fats. They're not processed. They're not, highly sugared, and they're not these types of foods. The junk food lifestyle. You don't want that. You want whole foods. You want the good olive oils, the olives, the grapes, things that are wholesome and nice for you. And these things are very good for your heart health as well as your health in general. That's another thing to take in consideration. And then, if you're on any meds for blood pressure or for cholesterol, blood pressure more than cholesterol. If you have blood pressure issues, you need to be on your medication, because that lowers many risks. And then, of course, you have your supplements. There are supplements that people take for heart health. There's a CoQ10, which is very good. There's your fish oils, the good fats, krill oil, fish oil. These things help your body and help your arteries stay patent or open, which is very important. And then the third thing is stress reduction. If you have a lifestyle that's very stressful, and it's always impending on you to do this and do that, and you're going from task to task, you definitely need to slow down. And one way to slow down is to actually schedule your things, whether it's your notifications from your phone, or whether it's meetings from work, or whether it's access to you yourself 24 hours a day. Nowadays, everybody through their phones, people call you, text you. Block the notifications. There's no need for them to have access to you at 11 o'clock at night. There's no need. If it's not a close relative, your mom, dad, aunt, uncle, there's no need for work or these things to have access to you at that time. That should be your time. Take care of yourself. Self-care is very important, and that helps with your heart health and your health in general. That's very important. Other things which are important nowadays in terms of uh, heart health is your gut biome. There's a lot of research that shows that your flora in your gut, if you have a healthy flora in your gut, meaning that the bacteria that are endemic, that live in your gut, are not depleted, and they're healthy and flourishing, then your heart will be fine too. So a way to increase the good bacteria in your gut is to take the pro and prebiotics. And pro and prebiotics, you can do yogurts. There's many things at your grocery store that you can get that are probiotics. You could get pickled vegetables, pickled food. Those are very good for your gut health. And not to overdo it, but to keep it in the middle. Not too much, not too little. Just keep it balanced. That's important. You can do research into that, and we'll talk about that as well. We'll also talk about approaches from a functional medicine point on one of our shows to heart disease and heart health in general. Functional medicine, of course, looks at the root of the cause of heart disease, which is inflammation. Inflammation is the cause of your atherosclerosis. It's the cause of your plaques in the heart, in the arteries. It's the cause of the inflammation of the lining of the arteries and veins. It's the main culprit. So the question is, how do you decrease that inflammation? If that inflammation is decreased, it's the major cause of disease, heart disease, then your heart disease symptoms will decrease as well. So we'll have another program on that sometime soon. But for now, an anti-inflammatory diet is very important, and that involves having half your plate with greens and reds and oranges and vegetables and things like that. Colored, half your plate when you're eating should be colored, and then maybe a fourth of it should be your carbs and your like potatoes and carbs and breads and things like that, and then another fourth should be your protein, your lean protein. I always advocate the Mediterranean diet. The Mediterranean diet is something you can look up. The more you eat from the Mediterranean diet, the better heart health you have. Heart health is good heart health that has been researched, and the Mediterranean diet is a very, very good diet for heart health. That's something that you should look into. Um, with that, I'd like to, leave heart health where it is. Take care of yourselves. Make sure that you're not stressing and you're doing your breathing exercises or meditation or prayer, whatever you need to do to get away from the mundane tasks of life and kind of open your mind and relax and think about yourself and your health and what to do to make things better for yourself, for your family, for your loved ones. That's very important. If you can get away for a quick vacation somewhere, do it. It's a good time. Numbers are down. You can pretty much travel and take advantage of that. You never know what's going to happen later on. So I encourage that, and I hope you're doing well. And we'll see you next week with another topic. Thank you for attending. And if you have any questions or concerns, please don't hesitate to comment. Take care and have a wonderful week.